The dorsal plantar or AP projection of the foot is performed with the patient seated on the table. A lead shield should be placed on the patient's lap for radiation protection. The patient's foot is placed plantar side down on an 8 by 10 inch image receptor. Hold the leg in the vertical position by having the patient flex the opposite knee and lean it against the knee of the affected side. The central ray is directed at a 10-degree posterior angle to the base of the third metatarsal, or you may put the image receptor on a wedge platform to prevent foreshortening. Collimation improves radiographic contrast. When making the exposure, the patient should remain very still, but suspended respiration is unnecessary. The AP foot radiograph should demonstrate all skeletal anatomy to include the phalanxes, the tarsus distal to the talus, as well as the metatarsals. Appropriate contrast and density will demonstrate both soft tissue and trabecular of the bone. The AP weight-bearing projection of the foot is performed with the patient standing. A lead shield should be placed on the patient's abdomen for radiation protection. The patient's feet are placed plantar side down on a 10 by 12 inch image receptor. The central ray is directed at a 15-degree posterior angle to the level of the base of the third metatarsal. Collimation improves radiographic contrast. The AP weight-bearing foot radiograph should demonstrate all skeletal anatomy, including the phalanxes, tarsals distal to the talus, as well as the metatarsals. Appropriate contrast and density will demonstrate both soft tissue and trabecular of the bone.